Welcome to the physical therapy segment on the Old Fashioned Health Network, where we always say good health inside and out. Today we're going to talk about carpal tunnel syndrome. Carpal tunnel is simply a condition that people can have in your hand and wrist where you have altered sensation or sensory loss. You can have muscle weakness and just poor general function and mobility in the hands. So what is carpal tunnel? So it's just like it sounds. It's a tunnel kind of in the wrist area here where you have nerves, blood vessels, and the tendons to the muscles that move the hand and the wrist. All of this runs through this tunnel, which what we call the carpal tunnel. So what are some signs and some reasons that you might have carpal tunnel and you might need to get it specifically diagnosed and special tests to make sure that you have this type of condition? So one thing that you might want to realize is just poor general mobility, not being able to do the things with your hands that you normally do on a daily basis, having pain in the hands, sensory loss, altered sensation, poor dexterity in the hands for us the stretching and ability to move your fingers. But let's be more specific. There's specific ways and specific areas of the fingers that are called for the carpal tunnel syndrome. So specifically the thumb, the index finger, and the middle finger, and maybe the tips of the middle finger and index finger as well. If you have altered sensation, pain, any of those things that we just called out and just followed through, in the other part of the hand, that could be typically some type of other disorder, other type of condition. Also, one thing you can look at is the thenar eminence, which is the musculature below the thumb. This area here, this little fat pocket here, is muscles. If you see atrophy or muscle waste or the muscle decreases in this area, that could also be another sign that you could have carpal tunnel syndrome. So what are the reasons why I would get carpal tunnel syndrome? You can get carpal tunnel syndrome because of repetitive movements, whether that be stuff you do as a hobby, at work, anything like that. So repetitive movements with wrist flexion, wrist extension, repetitive gripping activities or gripping jobs, or some type of sustained pressure at the wrist area, whether it be something that you have on your hand, on your elbow, any type of sustained pressure. Another reason you can get carpal tunnel is falling and having some type of fracture. There are bones called carpal bones, or which are the bones of your hand, in the area, hence the name carpal tunnel. And if you fall on those bones or have some type of injury, whether there's a fracture or anything like that, that can also cause irritation to the area. Also, you can get carpal tunnel due to arthritis. Again, these are bones in the hand and you can get arthritis there. So all of this together causes irritation, it causes inflammation and swelling in that carpal tunnel area, which presses on the nerves that supply the hand, causing altered sensation, pain, and all the other signs and symptoms that we listed previously. So in this specific case, we're talking about the median nerve, which is the nerve specifically for carpal tunnel that is compressed and altered due to the following signs and symptoms that we talked about. Also, a side note, pregnancy is another thing that can cause carpal tunnel, which a lot of people don't know about just because of the general swelling that happens as a woman goes through the stages of pregnancy. So now you want to know, what can physical therapy do for me for carpal tunnel syndrome? Carpal tunnel has specific tests that provoke the signs and symptoms to let you know that you indeed do have carpal tunnel syndrome. Physical therapists and other professionals can administer those tests to you to make sure that you do have carpal tunnel syndrome. The next thing, if you do have carpal tunnel syndrome, a physical therapist will work on joint mobilizations, they'll work on stretching of the nerves, stretching of the muscles, strengthening of the muscles in the hand, all to help the area and help facilitate better function in the hand. Also, another thing you can do, physical therapists can talk to you about nerve protection, whether it be some type of sling, some kind of splint or something to protect the area for the time and almost just give it some rest to heal itself. Also, physical therapists can work on patient education and modification of something that you're doing. If it's your job, is it a hobby, we can talk about some different ways to cut down on the repetitive movements that we talked about earlier that's causing these symptoms for you, giving you the carpal tunnel syndrome. All right, so we talked about what carpal tunnel is. We talked about signs and symptoms. We talked about reasons why you can get carpal tunnel syndrome, and we talked about why you might need me as a physical therapist if you do have carpal tunnel syndrome. So this is the physical therapy segment on the Old Fashioned Health Network, where we always say good health inside and out.